So, what chronic bronchitis is, Sarah? It is characterized by a cough that lasts for 3 months over a course of 2 consecutive years. Often they're called blue bloaters because they use a lot more of their chest muscles to breathe instead of their diaphragm, which is their main muscle to breathe. And they also start turning a color of blue due to lack of oxygen in their respiratory system. One of the main reasons you probably have it is because you smoke a lot of cigarettes. Not gonna lie, you smoke a lot, and that's not healthy. Also, you have very poor posture because you work on a farm, and you're always bending over, picking up heavy stuff. So there's also a lot of dust and pollution too that could also cause some problems in your respiratory system. Now, some signs and symptoms of chronic bronchitis, you might have a persistent cough with very thick mucus, or you might start breathing with your chest muscles more and less with your diaphragm, or you might start hearing a wheezing sound when you exhale. Usually this cough that you get worsens in the morning or in damp or cold weathers. You also might have frequent respiratory infections such as ammonia and heart failure and cyanosis. Some interventions that could be helpful or help treat chronic bronchitis would be some medications such as antibiotics, anti-inflammatory agents, or bronchodilators. You could also focus on lifestyle changes or behavioral changes, such as if you're a smoker, stop smoking. Or if you're constantly slouched over, that would work into postural changes, correct your posture to allow easier breathing. Avoiding breathing/lung irritants. So, as I said, no dust, no pollutants, no smoking. Help decreases your risk of having chronic bronchitis. Have a face mask on if it's cold outside. When it's cold or damp, it irritates the weather irritates your lungs, making it harder and more difficult to breathe. So just by wearing a face mask, you'll stay warm and you'll have an easier time breathing. Strengthening and stretching the diaphragm is a great way to start using your diaphragm more. Since it's your primary breathing muscle, you want to focus on using that more than any other muscle to breathe. It's very helpful. And correcting your posture. As I said before, posture is a huge factor that plays into chronic bronchitis. If you're always slouched over, you're not allowing yourself to intake as much air as you could be if you sat up straight or just had better posture in general. So diaphragmatic breathing is what we use to teach you how to breathe predominantly with the diaphragm. And we're focusing on how to learn to breathe with the diaphragm, and we're going to try to use your secondary muscles such as your pecs and your scalenes and your sternocleidomastoid, SCM, and all those muscles less. So that's what we're going to learn with diaphragmatic breathing. Some outcomes that we hope to see is an improved tolerance to exercise and activities, and decreased or a subjective improvement in your dyspnea or your shortness of breath. So how we start this is we start the patient lying in supine if there's no discomfort when they're laying down, or we start them in semi-Fowler's position if there is some discomfort felt. And then we have the patient breathe in and out a few times while we analyze whether they're using their chest muscles to breathe or their diaphragm. Once we have determined that, we place one of the patient's hands over their diaphragm and one over their upper chest. And when we ask them to breathe, and when they breathe, we see which hand rises more. If their chest muscles rise more, then they breathe with their accessory muscles. If their stomach or abdomen area breathes out more, they use their diaphragm. And we're just trying to get neuromuscular control over the diaphragm, so they use that more. Now, some ways to progress this exercise is if you start putting resistance onto the diaphragm. So when they breathe in and their abdomen and diaphragm expand, we would put mild resistance, lessening as they go up. Or we can put such as an ankle weight on the abdomen area and have them breathe and push that towards the ceiling. Another intervention that we can do is some postural strengthening and stretching with some controlled breathing. So the controlled breathing exercise we're going to use is pursed lip breathing. And pursed lip breathing is when your exhalation is twice as long as your inhalation. So you will breathe in for 2 seconds and exhale for 4 seconds. Now we're going to incorporate this with some seated row exercises so we can strengthen the middle trap and rhomboids to bring the patient into a more upright position. While simultaneously we're going to stretch the pec major and minor to lessen the tightness of the pec muscles to have a more neutral spine position. So with seated rows, we instruct the patient to have their arms bent